Hello everybody, my name is Jonathan Speight and I'm an athletic training student, a senior here at Emory College. And today I'm going to be talking to you about groin injuries. And more specifically, the risk of groin injuries in soccer relative to torso and femur length compared to height ratios. So before I even begin, what does that even mean? So this study is kind of complex. And it's easy to twist words and misunderstand what I'm saying. So what I'm doing is I'm looking at athletes, specifically male soccer athletes, and determining their femur ratio to their overall height and their torso ratio to their overall height. And then I'm taking those numbers and seeing how each athlete differs. So how athletes with longer femurs differ to athletes with shorter femurs, and how athletes with longer torsos differ to athletes with shorter torsos. What was the purpose? So, for those of you who do not know, I had the pleasure of clinically experiencing with the Emory men's soccer team this semester. And while I was with them, I saw several trends related to their injuries. The majority of the injuries that I saw were lower extremity injuries, and a lot of them were groin injuries. And there was one particular case, an athlete who was recovering, and I was helping him with his rehabilitation, to an athletic surgical repair, athletic pubalgia surgical repair, so groin injury surgery. And him specifically, he had a very long torso with pretty short femurs compared to his overall height, which got me thinking, maybe there's some kind of anatomical formula or something that predisposes these athletes to having groin injuries, or even injuries in general. So I started doing some research, and I found that no, there's not. No one really has looked at this. A lot of people have looked at strength, even how an athlete can reach, but no one has looked at anatomical markers of length to determine whether or not an athlete is predisposed. And if we can determine if an athlete is predisposed, we can use that for prevention. And prevention is the first step of treating an injury. If it never comes through the door, then you've done a pretty good job as an athletic trainer. And groin injuries in soccer. So just about a third or more of our soccer team experienced a groin injury, has experienced a groin injury within their collegiate playing time. 13% of all injuries in soccer are related to the groin, and 58% of soccer players have reported having a groin injury of some sort at some time. And then looking to just gender differences, males are far more likely to have groin injuries just due to their heavier and more narrow pelvis, where ladies have a little bit of a wider pelvis to help with birth later on in their lives. We have a more narrow pelvis. So, and also kicking and other motions predispose athletes to groin injuries. And we know that soccer players spend most of their time kicking and then cutting and moving around in the lower extremity, which also predisposes athletes. What I did get from the research that I looked at, the previous research, was that there are averages out there for what athletes or what people in general should be. And that ratio, the average ratio, is about 26%, or 0.26 of the total height of an athlete. So the femur should be 0.26, the torso should be 0.26. If the femur is longer than 0.26, then they are long femur. If it's shorter, then they are long torso. My thoughts. So after seeing these differences, I came up with the clinical question: is there a significant difference in torso length to height and or femur length to height in male soccer players? And I separated them into three groups: non-injured, those with groin injuries, and those with injuries besides groin injuries. I then took the measurements that I had and would separate them, the athletes, into those sections: injured, non-injured, and other than groin injury. My experimental hypothesis was male athletes with abnormally long torso and short femur lengths when compared to their overall height will be more likely to be different from athletes that had no injury. Meaning that if you had a short femur and a long torso, you're going to be far different in comparison to an athlete who had no injury at all. Methodology. So the first step of my methodology was sending out a survey, and I sent it out to the entire male soccer team, men's soccer team here at Emory-Henry, and I got a 70% response, which is pretty good numbers. And once I got that response, I asked them to come in and I took anatomical measurements of their femur length from the greater trochanter to the lateral condyle, and of their torso length from the jugular notch to the pubic symphysis. I then took these data points and compared them to their survey answers. So athletes who said they were injured, athletes who said they were injured with a groin injury, and athletes who had no injury at all. I did this data analysis using an ANOVA test, which made things a little bit complicated, but I pushed through. And the ANOVA test shows you just how different each group is from one another. So how different an injured athlete is to a groin injured athlete to an athlete with no injury at all. Results. So this is a little chart of the responses from the survey. So 14 athletes said they had a hamstring strain, 3 had a quadricep strain, and so on and so forth. And then results continued. So this is a scatter plot of average femur lengths compared to their injury status. And as you can see athletes, one being no injury, are very different. See how high they are compared to athletes who have injury in general or a groin injury. And that's what I was looking for, that difference in height, something to separate them. Due to the complexity of my data analysis test, I ran into some trouble with testing torso length ratios. And I ended up putting that into my limitation section, saying that that was something that I planned to do, but was unable to succeed in doing. Conclusion and discussion. So, after performing the study, I was able to see that there is a statistically significant difference in athletes who had no injury, athletes who had an injury, and athletes who had a groin injury. And that statistical significance kind of paved the way for me to continue on with my research. So now that I know there is a difference, I can then go ahead and apply a correlation value later on. And this correlation value can be used to determine just how correlated an injury is to its anatomical value. And then future research ideas. Like I said, I would really like to continue on with doing correlation studies, but I'd also like to expand it to multiple universities, colleges, possibly over several divisions. And another really good idea that I had with conjunction with Beth was possibly studying how an athlete with a different anatomical measurement of femur, so someone with a longer femur or a shorter femur, or a longer torso or a shorter torso, how they fire their muscles when contracting and kicking the ball. So maybe their contractions are different or follow a different sequence or something of that nature. And maybe that would lead to the athlete being predisposed to injury. Any questions? DC code.
I got a few. Your measurements, where did you find to take your measurements for what qualified as femur length and torso length? Where do those come from?
So I scanned a wide variety of different resources. Some of them had to do with measuring specifically for tests kind of like this, nothing nearly like identical. And some of the measurements came from just other studies where people had standardized the femur to do like blood pressure studies of the foot, or standardized the torso to study how different musculature attaches.
So did they all have the same 4 points though?
The ones that I saw, this seemed to be the consensus.
Okay. And I think you answered this question, but I'm going to ask it anyway. You looked at short femur versus long torso, but you didn't look at long femur. Short femur, long torso, but you didn't look at long femur, short torso. Is that because of the problem with the ANOVA that you came in?
I looked at short femur and long femur. I was unable to look at short torso and long torso.
Okay, so that's where I'm going.
He wants his ratio.
Yeah. Because if you have a short femur, then you have a long
Yes.
torso.
So technically,
So that's always matched.
It's always matched.
Always
Technically,
Yeah.
they correlate. They're supposed to correlate perfectly with the ratio. If you're over 26, then for the femur length, you have long femurs and short torso. However, I wanted to be able to prove it on both sides of the track, so that way the data was more precise, more relevant.
So no one ever has a short torso and a short femur?
They shouldn't. No.
Yeah. Like sometimes
Well,
there were some that were
unless they're-
closer.
They can be.
Yeah.
They can be
I would see
close.
little people.
But one will always be slightly dominant.
They can be close, and someone can have
Normal
a longer
stature.
torso
Oh my
and
God.
what would be considered
Well,
a long femur,
my
but it would not
arm
have. It would never be like
Well, the
long.
one we call Markins too.
So torso is
So
always
you can-
longer than femur.
Yeah, you can see
Torso's
people with
huge,
a
but
little bit
femurs
shorter tibias,
small
people with a little
relative.
bit longer necks.
So
That
it's-
happens.
My last one has to do with you're asking the athletes about injuries, and I noticed some of those injuries. Would they know what they were, like iliopsoas strains and athletic pubalgia and things like that?
Several of the athletes ended up contacting Beth, and I had athletes come up to me and ask what
Okay.
they were. As well as when I was doing measurements, I went over what they had said in their survey to make sure that they had an understanding of what they had
Okay.
checked.
Our argument was if they've had it, they should know it, and that way they wouldn't falsely
That was,
select something.
that was one of our assumptions, that an
Yeah.
athlete would be honest. And,
Yeah.
So it's not a stereotype, but many soccer players are more or less flexible in their lower extremity.
Talking about hamstring tightness?
Yeah, well, and all over, a lot
And
of
all
times
over.
they are. Have you thought about later controlling for that and assessing that during? As that will throw, I only thought about it when you mentioned the sequencing, the firing sequence, because typically if that's off, it's typically due to some type of muscular imbalance. And that may be a way to, I mean, that complicates statistics even more, but.
Yeah, I hadn't thought about that, but I also, while taking my measurements and putting my survey through, I asked some other questions as well, such as mechanisms to the injuries, how long they had been involved in collegiate sports, plus how long they had been involved in the sport in general, as well as what their dominant side was and what side the injury occurred on. So I have some room to continue my research.
And all of those occurred during soccer play, I would
Yes.
think as well.
And that was just in their whole history that they had
Yes.
on?
Any further
Not
questions?
within the
Okay,
year.
this is actually just out of curiosity. Does that ratio change with age? Like as in once you get to puberty, would that influence that at all?
The length ratio.
Yeah.
That's an adult ratio.
Yeah, that's,
So you asked prior, after.
Mhm.
yes, and every single one of the athletes that I studied was 18 years of age.
So it was any injury after.
In college.
In
In college, it was,
Okay.
it was a collegiate injury. So all the freshmen were answering only on one semester,
Gotcha.
where seniors could be answering on.
4, 5, 6. Who knows? Yeah.
However long it needs to stay.
Yeah.
Were any of those, where they had multiple groin injuries? Is there
Yes.
any kind of pattern that related to that?
So groin injuries tend to repeat themselves. They reoccur at an extreme rate, more so than many other injuries. And a lot of the athletes, we never asked this, but from working with my clinical experience, a lot of the athletes would have reoccurring problems and would complain of reoccurring problems.
So that might be something you include as you expanded on your survey, is how many times have you had a groin injury might be a good one to include.
I had an athlete come up to me because they were curious. They've been studied, so they were curious on what my results were and how they related to them. And they said, well, am I predisposed to a groin injury? And I said, well, I'm not going to say that at this point. And they said, well, I've had two. So I looked at her and said, well, what do you think?
What does that
Thank you
say?
very much.
Was this dominant kicking leg, or did it matter?
So the majority of the time, the injury was on the dominant leg. However, I didn't include that in my study. That'd be something interesting to go back and look at.
So we've given you your entire research agenda for your entire career is what we just did.
I got some wiggle room.
Yeah.
One
And also-
sample, tons
I
of
mean, you
studies.
found your athlete with the longest torso
Yeah,
had the most
exactly.
injury history.
The athlete with the longest torso and by far the shortest femurs. It was crazy what his ratio was. And this was a really tall athlete too. Had so many injuries. It was just one after the other after the other.
And then the one with the
And then
short torso, longer femur ratio
Had no-
lower
And
extremity
that was-
injury history.
And
I mean-
shorter? No.
Had shorter torso, longer femurs.
So I never get hurt.
everyone- the only two athletes who had what would be considered long femurs didn't have injuries.
Was it there?
The third was close.
Borderline.
He was that borderline.
Yeah,
where
he was
you
that
go-
weird one.
And there was a few who were borderline who also had injuries, but the majority of people who had injuries were blood. All right, thank you very much.